What's up, everybody? Welcome back. A lot of people struggle with neck pain or stiffness or neck tension. And I think one of the reasons for that is an inability or a difficulty with getting good mobility or movement in your upper back, lower neck area, or specifically our CT junction. So it's a spot like right through here. And what I find a lot of people do is they overhinge through the middle part of the neck. So we see this with motion. If I were to have somebody look up towards the ceiling, I see a lot of this. It's like an excessive hinge right through the middle of the neck, or maybe through postural things like computer use, we get cooped up here and our neck folds right through the middle there. And I can't say that this is gonna lead to pain. I do see a lot of people that seem to have neck pain and have that type of thing going on, but I do think it definitely will start to contribute to loss of movement in other areas, specifically the upper part of the neck and then the lower part or upper part of the back. So one of my favorite things to do is just a quick little mobility drill is to use a strap. So I use a yoga strap that I have here in the office. You can use a belt, you can use really anything. It could be a TheraBand or just a rolled up towel, anything that's going to give pressure in the area that we want. And then by putting that pressure there, then we move our neck. That's going to influence motion below the area of the strap. What you'll do is you'll grab that strap and I put it as low as I can get it. So I don't want it to bunch up towards the middle part of the neck. I want to get it as low as I can get it. So you can see how I have it nice and wide. I nestle it there. I come in wide with the straps here, and then I just pull down just a tad. The exercise comes in where I will push my head straight back and then tilt it up towards the ceiling. Some key things here. I don't want you to just default into your normal positioning of here. I use the analogy of a bucket of water that I'm gonna have it on a table. I'm gonna slide the bucket of water to the edge of the table, and then I will tip it over. You notice my head is moving backwards the whole time. So if you feel like you move your head back and then as you look up, it stays in the same spot or starts to drop forward, that's not the point of the exercise. Straight back, all the way up towards the ceiling. You should feel this not right in the middle of the neck, but just below into that, what we'll say C7, T1, T2 area, okay? I will recommend this to people to do throughout the day, okay? I might say, all right, do 10 reps every hour or two, just to keep things moving, especially if we're cooped up into the computer quite a bit. It's a good way to reverse our posture. Things you want to watch out for: if you're trying to do this and your neck is pinching a lot or it's really painful, you can't really work around it, this might not be right for you at this time. Other things I really don't want to reproduce: if you're moving your head in these different positions and you're feeling symptoms going down the arm, definitely not something I want to work into as well. However, this is something that I give people that wake up with that stiff neck and they can't move a lot. Have them do about 10 reps of this, and then they recheck their motion, and lo and behold, they do get a little bit more mobility with a little bit less pain. There you have it, real simple. Trying to get our CT junction, or the lower part of the neck, upper back, a little bit more mobile, okay? We're using a strap to help influence that motion, and we're going to repeat this frequently throughout the day to keep things moving. Obviously, look out for some of the pain things I mentioned earlier in the video, but this is a nice thing to try. Let me know what you think. I think it feels good. I enjoy showing it to patients because it's a time for me to work on it. But I want to know what your thoughts are. Let me know. I'll see you in the next one.